There are different types of knee pain. There are different types of knee pain. घुटने के दर्द बहुत अलग अलग तरीके के होते हैं. हम हमेशा सोचते हैं कि घुटने का दर्द एक ही होता है, osteoarthritis. It is our wrong ambition. It may be ligamental, it may be strain, it may be an injury, it may be anything. Knee pain has large number of reasons. Today we'll study about the knee pain. How to revive a person from different causes of knee pain. So today we'll study about two things. How today we have made slight changes in the mode of study, because I understood many of the people do not understand the diagnosis of the patient. Most important is, what is the people suffering from? आदमी क्या चीज से सफर कर रहा है? हम लोग ये नहीं समझ पा रहे कि आदमी क्या चीज से सफर कर रहा है. We are only suffering that, oh, he is having a knee pain, and tomorrow again he is coming and complaining, यहाँ दर्द है, तो यहाँ नीडल लगा दो, ये दर्द चला जाएगा. Did you ever confirm what kind of pain it is? It's a ligamental, it is a strain, it is a
Osteoarthritis.
triggering point, it is a stiffness. It may be hundreds of reasons, right?
Yes, sir.
उस दर्द को समझने के लिए पहले ये समझो कि वो दर्द किस कारण से उसकी उत्पत्ति हुई है. पहले दर्द को समझो. You have to understand what is the cause of the pain. If you don't understand the cause of the pain, you will never be able to understand how to recover a disease. यानी आप बीमारी को रिकवर नहीं कर पाएंगे. You can only recover pain. Now let us understand one more thing. What?
Charging लाना पड़ेगा.
What should we understand?
माइक है इसमें. कहाँ से? यहाँ से ऑन करना पड़ेगा.
There are two things we have to understand. What are the primary two things we have to understand?
आवाज यहाँ से भी कट हो सकती है.
Pain is a symptom. Pain is a disease. When pain is diagnosed, it becomes a part of a disease. But when pain is a symptom, it is just a symptom. So whatever you are treating right now in knee pain, these is what? Symptom. यानी आप आज तक जो ट्रीट कर रहे हैं, अभी तक जो ट्रीट कर रहे हैं, इस तरह से ट्रीट कर रहे हैं, वो सिम्टम है. यानी थोड़े दिन बाद वो फिर कुछ नया फचरा खड़ा करेगा. यानी it will start something new, something this, something else will come out tomorrow.
दोनों में आ रही है आवाज.
You understood what am I saying?
Yeah, but the background sound is disturbing.
Now can you hear?
Yes, now I can hear you clearly. Thank you.
I'm teaching today you about knee pain. Knee pain generally you know as osteoarthritis or ligamental pain. There are hundreds of reasons for which a knee pain can occur. घुटने का दर्द बहुत कारणों से हो सकता है. सबसे पहली बात होती है उसकी डायग्नोसिस. किसी भी बीमारी को समझने से पहले ये कलर लगा लो, वो कर लो, ऐसा कर लो. क्या आपने उस लोकल प्रॉब्लम को सॉल्व किया है जिस कारण से उसकी उत्पत्ति हुई है? यानी जिस प्रॉब्लम को हम लोगों को हमारी लाइफस्टाइल, हमारी जिन चीजों से उसकी उत्पत्ति हुई है, द कॉजेज ऑफ पेन, डिड यू एड्रेस इट? Did you? Again, you have unmuted the mic.
Co-host, please mute them, please. Thank you.
Mr. Gandhi, please guide the mic.
So today I'll show you two things. First of all, what is the difference between a practical teacher and a theoretical teacher? I'll show you. One patient was referred to me, a 65-year-old man who was unable to walk for 2.5 years. I think 2.5 years, na? You, there was the one who referred me from the team. कितना साल पुराना केस था वो? 2 years? Hello? Almost 2.5 years, and he was unable to walk. It is a massive stroke. It is called uh, ganglion bleed.
Ganglion what, sir?
Ganglion bleed, I forgot what it's called.
Okay.
Ganglion basilar bleed.
Oh, ganglion basilar brain, yes.
Yes, basilar ganglion bleed, you can see. This type of patients, they do not recover. And it was difficult to recover in 2.5 years. It was referred to me, and I show you how easily, if you know about the anatomy of the muscles, where is the weakness, you can recover the patient in just 10 minutes. The whole treatment procedure is on record. It was not recorded properly because today we had a crowd in the clinic, but somehow I recorded the procedure and I have recorded it on my Facebook, so that you can go and silently see it again and again. Number one. Number two, I'm going to teach you about various types of knee pain. बहुत सारे कारण होते हैं घुटने के दर्द के. अगर आप ये सोचते हैं कि घुटना खाली ऑस्टियोआर्थराइटिस है, लिगामेंटल पेन है, ये है, वो है, तो आई थिंक इट इज रॉन्ग. 5 elemental pain cannot be osteoarthritis. Medical acupuncture is totally different from 5 element. Today now the thing is that people will come with an X-ray and you explain him your water is less, your rigor is less, or this is left, or that is left. People will what? People will accept you after 3 years?
I don't think so.
People will ask you clear explanation of what you are suffering from and how to recover it. And your diagnosis should be so way that when the moment the patient enters the room, you must be able to understand by his walking pattern what is he suffering from. यानी जिस तरह से वो वॉकिंग कर रहा है, उस तरह से अगर आप उस बात को समझ पाए कि वो किस तरह की बीमारी से ग्रसित है, then you are a good physician. Using number of needles, number of experiments, and putting colors, this may what? Give some symptomatic relief because body is very dynamic. Even because it is made by God and thousands of evaluations. You put one green color here, yes, you may get relief. But what about the problem which was created? जो प्रॉब्लम वहां लोकल क्रिएशन हुआ था, क्या वो सॉल्व हुआ? So today we will see two things. What about each kind of pain in YouTube? This type of pain is what? How this type of pain is there, and how to revive this type of pain. Right? So I have given my slides. These are generally anesthetic slides. What these are? These are called for real pain management anesthetic slide, which I have converted to an acupuncture slide. Generally, these points are used for what? In anesthesia, pain management. But I have converted it to what? Prolotherapy also, advanced prolotherapy also, and anesthesia. What? Acupuncture also. Now you can work in these three techniques and you can resolve large number of patients. So can we go to the slides of today? यानी एक बात समझ लीजिए कि जब तक आपको ये नहीं समझ में आता बीमारी का कारण क्या है, ये कर लो, यहाँ में नीडल लगा लो, दर्द कम हो गया, वहां नीडल लगा लो, दर्द कम हो गया. अब दर्द का इलाज कराने आए ना, बीमारी का इलाज कराने आए, कैंसर का इलाज कराने आए ना, कैंसर का दर्द का इलाज कराने आए हैं. That you must understand. Today I gave you lower extremities. Let me see. Yes. open. So today I'll teach you about the lower extremities. यानी नीचे वाले हिस्से का दर्द को निवारण किया जाता है. सबसे पहले we have to understand what is the cause of the disease, why the disease has come. That is called the diagnosis. The most important part, किसी बीमारी का कारण को समझना. हम क्या करते हैं, ऑस्टियोआर्थराइटिस को देख लेते हैं. ऑस्टियोआर्थराइटिस का इलाज तो कर दिया, टेंस लगा दिया, ये लगा दिया, बाकी जो चीज रह गया उसका, जिसने उसको ट्रिगर किया वो, अगर इन ट्रिगरिंग पॉइंट्स को अगर हम ठीक से समझ लें तो आई टेल यू 80% of the problem is solved. How much problem is solved?
80%.
80%.
80% of the problem. And then I tell you how. Today we'll learn about what? Runner's knee. So, Wally, please go to YouTube and show them what is runner's knee.
I'll show them what is NST.
Runner's knee, yeah. Patellofemoral pain syndrome or runner's knee. You show them in YouTube. What is this first? Runner's knee.
सर आपका दिख नहीं रहा है चेहरा, तो डार्क हो गया. अब ठीक है.
वो स्टूडियो बन रहा है विकला यहाँ.
थोड़ा नीचे कीजिए.
अब
Answer.
can you see my face?
Yes, I can see your face, sir.
And my face is clear?
Yes, sir.
प्रकाश जी मेरा चेहरा क्लियर है अब?
Which of the videos do you want, sir?
Runner's knee. Let me see. This one. 1, 2, 3. Third number video. What is runner's knee?
Win at work by communicating effectively. With Grammarly,
Meet Ty. He is emailing a difficult client.
I think we should explore a few solutions.
Grammarly ensures Ty's confidence comes through in his writing. That way, clients see him as professional and polished every time.
Let's explore a few solutions.
Meet Dylan, who's prepping for a big investor presentation.
The revenue that our business will generate will triple in the next year.
Grammarly helps Dylan rewrite his point to be clear and compelling.
Our business's revenue will triple in the next year.
That's
So we're talking about the patellofemoral joint, the kneecap joint, between the kneecap itself and this little groove that it rides in at the end of the thigh bone. This is a joint that can give people a lot of problems, and there's a lot of ailments that can affect this joint. The thing to understand about this is a very high stress joint. The cartilage coating in this joint is some of the thickest cartilage of any joint in the body. And the reason for that is that this joint has some of the highest stress on it of any joint in the body. The quadriceps muscles, the muscles in the front of the thigh attached to your quadriceps tendon that goes through your patella or your kneecap and then attaches down onto the shin bone down in through here. Those are very strong, powerful muscles that exert a lot of force on this area. One thing that can happen is those muscles can get very tight over time. And what that does is it puts tension in the tendons, making them more irritable, but also creates a situation where you're essentially taking that patellofemoral joint and tightening it. The kneecap gets bound down in that groove, and that can cause a lot of pain. Some of what we're trying to accomplish with therapy is to help loosen that up. Both the muscle attachments, loosen up the muscle that reduces tension on the tendons, and then also loosen up the ligamentous attachments around the kneecap that can get bound down as well. A second thing that can occur is that people can actually have looseness around the patella. The ligaments that stabilize it can be somewhat loose and lax, particularly if someone has generalized loose jointedness. And this can cause extra motion in that kneecap joint that can also cause irritation. The goal of the strengthening exercises is to help strengthen them and stabilize this kneecap somewhat and help some of the irritation that comes from that extra motion go away.
See, you have to restart again and you have to pause in between, Walid.
What's up, guys? Coach Nate here.
Go to the first video. Allow me to speak in between.
With the run experience.
He is not there.
So we're talking about the patellofemoral joint, the kneecap joint, between the kneecap itself and this little.
Stop. This is called the patellofemoral joint pain. यानी आपके घुटने के बीचों बीच एक लिगामेंट टेंडन होता है, पैथोलॉजिकल टेंडन, जिसके कारण ये दर्द होता है. अक्सर इसको रनर्स नहीं बोलते, यानी जो ज्यादा चलते हैं, दौड़ते हैं, उसको ये दर्द होता है. यानी those who walk fast, run, they get this type of severe pain. And this is because of the weakness of the quadricep muscles. यानी quadricep यानी 4 muscles होती है. इनमें से muscles weakness होने के कारण this tendon cannot take the weight. It cannot take the weight of the knee. यानी वो weight knee का weight नहीं ले पाता. Now अगर वो knee का weight नहीं ले पाता है तो क्या होता है? Pain cannot be recovered. आप उसको green color लगाओ, red color लगाओ, blue color लगाओ, या कान में नीडल लगाओ, हाथ में लगाओ. See, pain can be relieved. पेन को रिलीफ करना बहुत बड़ी बात नहीं है, किंतु उसके साथ जो और बीमारियां खड़ी हो जाती है, शॉर्टनिंग ऑफ द लेग्स, प्रोग्रेसिव ऑस्टियोआर्थराइटिस यानी घुटने का और जुड़ जाना, आगे जाके घुटना पूरा जॉइन हो जाना, पूरा टेंडन हार्ड हो जाना, जिसको आप बता रहे हैं. अगर मसल्स और वीक हो गई, if the muscles become more weak, what will happen? Their tendon will become more weak. What will happen at the result? You will have very severe. What you will happen? You will have a very
severe pain.
Yes. For example, I use tongue point, PC6, heart 7, this one. Immediately endorphin is released. My local problem is solved. But if I don't solve this local problem gradually, what will happen?
The pain will come again.
No, it will further deteriorate. यानी ये और खराब हो जाएगा. आज 10 है, कल 20 हो जाएगा, परसों 30 हो जाएगा. After some time, you put tongue point, you will get pain relief, but the recovery is not there. No pain, no sufferings can be recovered forever because of wear and tear. हम लोग का लाइफ का लाइफस्टाइल ऐसा है जिसके कारण हम सब कुछ को ठीक नहीं कर सकते, बट इन चीजों को इस तरह से मैनेज कर सकते हैं जिससे ये हमारी जिंदगी में बाधा नहीं डाले. यानी we can manage these things in such a way Can you hear me?
Yes, now
Yes,
I can.
Swiji.
Yes, I can hear you, sir.
See, the most difficult thing about Richard Ten was what? He never he never spoke about runner's knee. He never spoke about the diseases which were discovered in Western medicine. He spoke about what? In between pain management. There are two things. What are they? Pain management and pain treatment. Now you understood, they say this yellow color, if you see, is what? And open the video, this one.
You want the slide, sir?
Video.
Groove that it rides in at the end of the thigh bone. This is a joint that can give people a lot of problems, and there's a lot of ailments that can affect this joint. The thing to understand about this is a very high stress joint. The cartilage coating in this joint is some of the thickest cartilage of any joint in the body. And the reason for that is that this joint has some of the highest stress on it of any joint in the body.
Stop.
The quadriceps muscles, the muscles in the front of the thigh attached to your quadriceps tendon that goes through.
Stop. See, the joint what you see is the highest stress, and this is called the patellofemoral joint. Now, can PC6, Heart7 or L1, L4, L5 can recover this type of pain?
No.
Can the people who has succumbed for this type of pain without diagnosing, can you recover it? It is a runner's knee or what kind of knee? So most important thing, what happens, why we and acupuncture has become unsuccessful in the world is because of our lack of modern diagnosis. Right? Now, you see this X-ray in runner's knee. How do you see runner's knee in an X-ray? Okay. Go to Google and write runner's knee images. Because of high strain, it becomes hard and then there is a severe pain. Because it carries a maximum weight. ये जो नीचे वाला joint है ये maximum weight carry करता है and उसके कारण patient को बहुत severe pain होता है. Color लगाना ये करने उससे patient recover नहीं होता है. अगर आप real treatment करना चाहते हैं, if you want to be a real physician, then you must know how to really recover the patient. Otherwise, short term you may gain, but what about the long term? I've been in this profession for more than 20.
Your voice is out, sir.
So you can see, this is how runner's knee is seen. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Second row, 1, 2, 3, 4, fifth picture. Second row, fifth picture. Yes. Large. You can see the patellofemoral joint has become very tight. And because of this, osteoarthritis has been created. Now the treatment what you have done, PC6, heart 7, all this will become what? Huh? A big question mark. You can see this is the runner's knee. Here you can see. The tendon becomes what? Tight. And it is called also chondromalgia. It is called what? You understood what I mean to say? You all understood? Did you understand what I mean to say? Hello, can you hear me?
Yeah, but part of your speech
Can you
is
hear me?
wrong. Yeah, now I can hear you clearly now. But before, up and down.
Because of your internet connection. Now can you hear me clearly?
Yeah.
So you could see, now you can see what is the X-ray of runner's knee. Please write down in Google Images, X-ray runner's knee. It is called
your
kneecap
patella
pain.
or your kneecap.
What is it called? No.
Kneecap.
This is called
pain.
kneecap pain. Most of the patients suffer from this one. Pain in the kneecap. Now you go to what? Google and type X-ray kneecap.
Having small problems with network, so it's a bit slow here.
It's okay. So, if you have any question, you can ask me. This problem happens because of the weakness of the quadricep muscles. Now, if you strengthen the quadricep muscles from the ear, NIBS, this pain 50% goes away. But then there are another points by which you have to stimulate, by which the pain subsides. यानी माथे में कुछ जगह नीडल लगा देने से ये पेन चला जाता है. Go to Google and see X-ray runner's knee. X-ray runner's knee. It is not here. Go to Google. X-ray runner's knee. Here you can see the X-ray of the runner's knee.
Samsung S22 with its S Pen function simply breaks the rules with its.
And using that image, doctor, can you explain to us what's something called runner's knee?
Yes and no. So, yeah.
Let's try.
So, there are actually two flavors of runner's knee. One has to do with the patella, which actually is out of this picture. So the patella runs in this groove here. And runner's knee is basically what happens when a runner with repetitive injury, so they run, and it causes inflammation of this cartilage here, and you get pain. It's almost like a training error in a way, because even though runners are super fit and they do take really good care of themselves, they do have a tendency to get like a muscle imbalance. So their quadriceps won't necessarily be strong enough to kind of, if I could turn this, you could see that part of it's like you want to lift the patella up and out of this groove so it's not rubbing as much. And if you run and don't cross-train, you don't get the opportunity to build that muscle up and actually kind of get that to go away. That's really the main way that you treat that is with physical therapy and strengthening of that muscle.
Stop. Now come to me. Come to the slides. Now you see, come to the slides. You see, all the athletes are strong, but you see, they are suffering from what? Osteoarthritis, patellofemoral tendinitis. It is called what? Patellofemoral
Iliotibial friction syndrome is one of the most common sports injuries in the knee. And we see it especially in athletes who do a lot of repeated flexion-extension motions of the knee, like long-distance runners and long-distance cyclists.
There was going on video.
The iliotibial band is actually the prolongation of the
Valid video
iliotibial
going
tract.
behind.
The iliotibial tract runs from the lateral side.
Put this slide.
To a small muscle. It's called the tensor fascia lata.
No, this one. This is okay. Our one.
The slide, please.
You're going to Google.
You want this slide?
Yes. See
Google,
now.
sir.
Yeah. One slide before. One slide before. Now, you put local anesthesia with this needle and you may have what? Number of complications in that area. Now, how to recover this pain? Most of the people will ask me, sir, can this pain be recovered? I will say, yes, it can be recovered by two things. What are they? ये दर्द रिकवर हो सकता है, ये रिकवर हो सकता है. किस तरह से? दो तरीके से. एक, इन जो पॉइंट्स आप देख रहे हैं, इस पॉइंट्स पर नीडल लगाकर स्टिमुलेट किया जाए तो, नंबर एक. नंबर दो, हम इसका डिस्टल ट्रीटमेंट बंद करें. कहीं ना कहीं हमें ये मानना पड़ेगा कि लोकल चीज लोकल तरीके से ही सॉल्व हो सकती है. लोकल प्रॉब्लम्स कैन बी सॉल्व थ्रू द local issues only. You cannot solve them through what? Distally. Can you solve Philippines problem from India? आप क्या फिलीपींस का प्रॉब्लम इंडिया से सॉल्व कर सकते हैं?
Perhaps no.
Can you solve problems of Philippines from India? Perhaps only you can give a aid. AID, aid, right? Am I correct?
Yes, sir.
But local problems has to be solved. Can I solve the problem of your curiosity from Guwahati, Hyderabad? Is it possible? To some extent, to some wealth, I can solve. But can I revive that area? No, it has to be recovered locally. यानी उसको locally recover किया जा सकता है. How? By various ways. First of all, write down the number one way. Strengthen the quadriceps muscles. यानी आपकी जो quadriceps muscles है, यानी घुटने से ऊपर वाली जो muscles है, उसको थोड़ा strengthen करना है. All athletes are strong. They do large number of exercise, but if you see, they have huge knee pain. They have large what? Knee pain.
Gee, what's your number one point? Can't hear you clearly.
Strengthen the quadricep muscles. Strengthen it. Strengthen.
Tendon.
Strength. S-T-R-E-N-G.
Strengthen.
Strength.
Yeah.
Yes, strengthen.
Strengthen quadricep muscle.
Yes. And then use NIBS technique. Putting your head like this on the skull. Suppose this is a skull. Putting over it. Those who know NIBS, strengthen the quadricep muscle. Yani, this is your hand. You put it over here. Can you see?
Yes, sir.
And put 2 needles here and stimulate it. Clear? And then go to the local points. Where are the local points? See that. These are the local points. Even in TCM, these local points are not mentioned. Now, in these 2 local points, you have to mention 2 more points. What are they? Stomach 36, GB 34, liver 3, and kidney 3.
Sorry, sir, could you repeat? Stomach.
Stomach 34. Stomach 36. Go previously. Stomach 34, 36. Go in the previous slide. Stomach 36. Along with these points. GB 34. NIBS. NIBS means strengthening the muscles from here.
Liver 3, kidney 3.
Yes. And then you can stimulate them. Best pen which I have used is brain muscle pain. And immediately you will see within 30 minutes, 5 minutes, the pain is what? Gone. And then you recheck it, the patient is feeling much what? Better. Often the pain is found on the lateral inner side. यानी अंदर की तरफ ये दर्द पाया जाता है. ये इसके पेन के आप देख सकते हैं पेन का तरीका. And this is how this pain is found. Am I clear?
Gee, sorry. I think the point you mentioned is different from the diagram.
Yeah, I have given you some additional point.
Oh, additional point. Okay, thank you.
Along with this.
So do we need to stimulate all these points as well? Or just for NIBS?
Yes, you must stimulate all. No. NIBS is must. Stimulation of this point is must. And strengthening of the quadricep is must.
For the local
First
points,
method is NIBS. Strengthen the quadricep muscles. Number 2, Put needles on all these points. Number 3, stimulate them. What will happen? The pain
will gone immediately.
Yes. The point, extra point which you should use is ST36, GB34. Liver 3, kidney 3.
So we stimulate the additional points as well, sir?
Yes.
With motor point pen?
Huh?
With motor point pen for the local points? The pen for
Brain and muscle is the best.
Okay.
Brain and muscle.
Okay, thank you.
Or you use your KWD, whatever you have. But KWD gives little inflammation later on. Whether it increases the pain later on.
So may I ask, what is KWD?
KWD you can see in the, it's a needle stimulator, which you can buy from Amazon. It is used by acupuncturists and dry needlers. Generally in India it is taught by KWD, but then this does not recover the pain because we did not identify what kind of disease he is suffering from. So please show them what is pre-annulus pain. So in YouTube, am I clear up to now?
Yes, sir.
Yes, sir.
Yes, sir. What are we looking at here?
Yeah. We are looking about that pre-annulus pain. What is pre-annulus pain? Diagnosis of pre-annulus pain.
Location. Sorry, sir. Location.
You copy and paste it.
Hi, G, can you hear me?
Yes, yes.
Yeah, can I ask a question?
Tell me.
Yeah, if the knee cannot be bent, does it involve with this knee joint pain?
Yeah, you are right. It is osteoarthritis with patellofemoral tendonitis. You have already seen patellofemoral tendonitis. The pain is always where? In the central area.
So this causes the knee cannot be bent, is it?
Yeah, knee cannot be bent.
Okay.
It becomes hard.
Yeah, yeah. Thank you.
And it becomes because of the weakness of the quadriceps muscles, and it is found generally in the sports injury.
Right, right.
Which of the videos, sir?
You can take the first one.
Save money. It's Conga's Mid-Year Shopping Festival from 1st to 30th of June. Enjoy huge discounts for all.
Hello everyone, this is Paul from Ortho Eval Pal. Today I want to talk about pes anserinus issues. Okay, so what is the pes anserinus? It's this area on the knee right here. And what does pes anserinus mean? Well, pes means foot, and the Latin for anserinus is goose. So goose foot. And what happens is your sartorius, gracilis, semitendinosus all come here and attach just to the anterior medial aspect of the tibia right on the top up here, and it looks like a goose foot where it attaches. Okay, now the way to identify it is to bend the knee just a little bit. We find the joint line, and then from there we can straighten back out. We just go down about a couple of inches. It's not dead center on the front of the leg. It's not completely lateral. It's like part of the center and then to the side a little bit. It's about 2 inches. Now, what can happen is you can get some inflammation here. You can get some tendinitis or tendinopathy of these tendons that come together here. And you can also develop a bursitis in this area where that fluid-filled sac between those tendons and the tibia can cause some irritation and get really inflamed. And as you can see here, there's swelling right in this area.
I'm coming
and
1 minute.
it's tender to
Please
touch.
show them the video.
Tendons that come together here, and you can also develop a bursitis in this area where that fluid-filled sac between those tendons and the tibia can cause some irritation and get really inflamed. And as you can see here, there's swelling right in this area, and it's tender to touch, okay, right there, and it feels really squishy, and it's quite painful, okay, when you get right in there. And this pain can be mistaken for many other things. Some people may mistake it for a plica or a meniscus problem or an MCL injury. But it's inflammation of this bursa and these tendons that come down. So the way I remember the tendons, sartorius, gracilis, semitendinosus, is say grace before T, and that's a way to remember those tendons in that order. How do you treat it? Well, oftentimes this happens in people who have some trauma to that area, or maybe surgery in the region that causes inflammation to that area, or it happens a lot in runners, especially runners who have a lot of this valgus angulation, or the knee kind of dips inward a little bit. And when it does that, it overstresses these tendons. So having a good orthotic in the shoe is important. Having good flexibility of the hamstrings and the musculature on the inside of the leg. And then I'm also a big advocate of really maximizing the quad strength and improving calf flexibility as much as possible. I also like to treat these with some soft tissue modalities, pulse ultrasound. If it's really painful, then electrical stimulation to help settle down that pain. Ice is very effective here. It's close to the surface, so things like a Voltaren gel can be helpful. But my treatment of choice is iontophoresis. Dexamethasone seems to really decrease that inflammation really well. And we know this is pes anserinus bursitis because she's had an injection for this in the past, and it immediately got better, correct? It just totally settled down. Yep. And that swelling settled down, the pain got better, and it's come back, but this has been a couple of years later. So that's what pes anserinus is. I hope you enjoyed today's video, and if you did, please give us a thumbs up. And if you haven't already subscribed, do so, and you're going to be lined up for a bunch more videos coming up. Thanks.
So can you see, this is a medial knee attachment tendinosis, overstrain syndrome of the knee joint capsule. So now when you overstrain the knee joint capsule, you have seen, if you lift the knee and then you take down, the pain is on the lateral side. Pain knee को थोड़ा सा ऊपर उठा के नीचे रखते हैं तो बाएं और दाएं तरफ आपको ये दर्द मिलता है. And the adjuvant treatment in median gonoarthritis. Now you can understand only one type of arthritis is not there. People cannot just recover by 1 or 2 points. You have to understand, even by putting these points without ST36, GB34, and recovering the, what you call, the fascia of the BL40, यानी BL40 यानी पीछे की जो मसल्स है उसको अगर आप रिलीज नहीं करते तो आपका ये पेन और सीवियर हो जाएगा, यानी रनर्स नी. And even in this case, you will find the same thing. So go to the points. See, intra-articular injection, I always advise because you may create a complication, but knee or pain stimulation by the pain never creates a complication. I am a person who always says, please don't create any complication. You create a complication, patient run away. Always try to go safe and best and immediate. If your diagnosis is good, what did Tung say? If your diagnosis is good, if your selection of point is good, if your method is correct, if the depth of the point is correct, you get a very good marks. Am I right?
Yes, sir.
यानी अगर आपका सिलेक्शन ऑफ पॉइंट सही है, आपका डायग्नोसिस सही है, आपने तरीके से काम किया, तो आपको इमीडिएट पेन रिलीफ मिलेगा. Neither by prescribing paracetamol nor ibuprofen will relieve the pain, because the cause of the pain is there. That is why a new subject has been created in medical science. It's called orthopedic and sports science. And you are competing with orthopedic and sports science. Am I clear?
Yes, sir.
G, how about saline injection?
See, saline injection and all you can give, but in Singapore it is not allowed for you to give.
Yes. But
so why don't you use your laser? Laser also recovers.
Yes, yes.
You have my pain. Pain also recovers.
Right.
You need to stimulate that area. That's all.
Yes. But I mean, saline is also possible, right?
Yeah, yeah. But then saline, see, you must be an expert of prolotherapy. You are going inside. You may endure anything else, right?
Yes. So when are you going to show us with the C-arm and the MRI, putting the needle and all that?
See, CM, MRI, we are not purchasing right now because in India we have to go through a lot of rules and regulations. In MRI, you will get nothing because in MRI room, you cannot take the needles. In CT, you have already seen the pictures. You write MK Sastri in Facebook, write CT procedure, you will see the pictures. I have shown you CT pictures also. We have given, again, we will give you how you see the needles, the depth of the needles in CT. But so far, CM is concerned, we'll show you in CM also the procedures. Live procedures will show you in CM. Next. These are the points you have to mention. This is the line of the pain, and these are the points which you can insert with the laser, KWD. But I always use brain muscle pain because I get chance to stimulate the brain also. At the same time, I stimulate the local area also. The patient is happy. Ultimately, the patient must be happy when he goes.
So one question.
Yes.
Do we do NIBS for sartorius and gracialis?
Yes, you should
And
always
do
do.
we have any additional points?
Same. These are the points which you have to do locally. NIBS, you have to go serratorius muscle, you have to look at the serratorius over here, near the knee. This is the knee. So, inserting one needle over here, two needles, stimulate, finish.
No, any additional points for locally?
I told you, NIBS, local points, this, and also you can use very good point. What? K3.
K3.
With
Okay, thank you.
BL64. BL64.
BL64. Okay, thank you, sir.
Am I clear to all?
Yes.
Yes, sir.
आपको मेरी बात समझ में आ रही है या नहीं आ रही?
आ रही है सर. हाँ जी सर.
हाँ?
जी सर आ रही है.
कि नी पेन एक कारण से नहीं होता है, उसके हजारों कारण होते हैं. उसको एक एक कारण को अगर आप डायग्नोस करके ट्रीट कर पाए, यू विल बी ए सक्सेसफुल स्पोर्ट फिजिशियन and you can recover the patient immediately. Even by kinesio tapping, if you put in this area, you get immediate relief. Then, when the patient is finished, game is over, recover that area by glucose and all, patient is what? Next day fit for his job. I've treated the chairman of consumer court who is down. You could see of the pain I have reduced it in 8 days, the pain has come back. It was his precondition that you will meet me to 95 lakh people of his association if I can reduce 50% of his pain. And today I reduced further 70%. And he is the chairman of the consumer court in India, which appoints the chairman, judges of the consumer court. His rank is of like it's a senior ranking person.
No audio, please. No video.
Am I clear up to now?
No video, sir.
For what? No. So these are the two things. First, you go and practice tomorrow. If I teach too many things, you will get confused. Now I'm going to show you one video from my Facebook, how I recovered paralysis, which I showed you. How 2.5 year paralysis can be revived with severe pain in just 10 or 15 minutes. If you have an opportunity to recover. That is also possible. All cases are not possible, but this is also possible. You can check. Go to my Facebook and see the first video. Second, yeah, this video. Play the first video. No, not this one. I think this one. This is the first video of today, na? Yeah. So play the first one. Yeah, this one, first one, where I'm putting the knee pain. No, this is the second one. Play the first one. This is the after result. This is a man of suffering from 2.5 years, and he came to me today with severe pain. Can you hear the voice?
No, sir.
Can you hear the Facebook voice?
No, sir.
No.
Why we are not able to hear the Facebook voice? Pain also, spastic paralysis. Now you can see how we are recovering him. So here you can see how I inserted the and it was a very busy chamber today. He is a man of 65 years, very scared. He was unable to walk. You are saying 25% pain reduced. उठाइए, हाँ, ठेलिए पीछे, पाँव को ठेल दीजिए, ऐसे नहीं, ऐसे करके देखिए. So now you can see how I have changed my technique.
क्यों लात मारे जान, होल्ड करने लात मारे जान. हाँ, हाँ.
अब दर्द कितना हुआ? लात मारते वक्त
नहीं कम हो रहा है, नहीं हो रहा है, जरूरत नहीं है.
दर्द कितना हो गया?
कम हो गया, 12 आना कम हो गया.
12 आना कम हो गया? Now his pain has been reduced to 75% reduced, and his spasticity also reduced.
वो भी चला जाएगा बाबूजी. भगवान है. सीताराम, सीताराम, सीताराम.
And this is his first sitting.
सीताराम, सीताराम, सीताराम.
Now you can see spastic paralysis and spasticity reduced.
दबाइए आपको. यस, वेरी गुड. पीछे दबाइए.
अब बताइए दर्द कितना रह गया? हाँ. अब देखो उसका और कौन सा मकसद है? डायफ्राम को रिलीज करो. डायफ्राम बोल दो, सांस लो, पूरा टाइट हो.
थोड़ा आप टेक डीप ब्रीथ करिए.
लंबी सांस लीजिए.
लंबी सांस लीजिए, गहरी सांस.
देखो ये पेट को दबाओ. In every case of paralysis, there is a diaphragm stiffness, and you can recover that diaphragm stiffness in just 5 minutes, just by stimulating a proper way, which I have changed. I have changed the brain mapping. I have understood a different way. Now you can see Now the patient can walk properly and he can climb staircases after 2.5 years.
झंझन बहुत ज्यादा है।
झंझन की बात नहीं बोल रहा, अभी अब दर्द देखिए।
बताइए बाबूजी, अभी दर्द कम हो गया, दर्द कम हो गया ना?
आप देख सकते हैं 2.5 साल बाद पेशेंट कैसे पैरालिसिस का पेशेंट का मूवमेंट, अब ये कैसे चल पाता है, उछलना भी कम हो गया।
3 महीने से दर्द ज्यादा ही था।
3 महीने से दर्द 75% ऑफ हिज पेन हैज बीन रिड्यूस्ड। अब क्योंकि देखिए दर्द कम हो गया।
भगवान है, आप लोगों की बड़ी मेहरबानी, बहुत धन्यवाद।
Now you go to the second video. Now you can see him walking. That second video, there are 2 parts. This, yes.
I can't see the video, sir.
Now you will be able to see, because he has not played. Now you will play. Walid, you can play.
Yes, sir, it's a network holding it.
Oh. International problem comes. You may ask questions if you want.
So what do you mean you changed the mapping? Is this the technique that you developed?
Pardon me?
You said you changed the mapping for the diaphragm. Is this the new technique that you developed?
Yeah, it is a totally new technique, and now we work very differently, and you get instant results. You can see a patient who was walking with 4 people support, now is walking with 1 man support. You were saying he did not have 1 leg. Now you can see he is climbing staircases. Person working with it, only 1 finger support. ये बोले थे मेरा एक पैर नहीं है. Now you can see he is walking with my 1 finger support. Patient walking independently with it. आपको 15-20 मिनट में कितना फर्क लग गया आपके पैरालिसिस में?
75%।
आप दुनिया को क्या बोलेंगे?
बिल्कुल 75% बोलेंगे। अभी 20 मिनट का आधा घंटे के ट्रीटमेंट में 75% सही हो गया। अभी ये कल क्या होता भगवान जाने, आज तो सही हो रहा है।
So you could see a recovery of more than 75% in just a single day treatment, and you can see the stimulation was provided from this needles. Photo लेना।
कार से लाया 2 मिनट पहले ऊपर से लाया, चलते से फिर एक दिन वहाँ बाहर 100 का वहाँ बिठाया, फिर अंदर लाया फिर वहाँ बिठाया।
आप इतनी देर खड़े रह पाते थे?
नहीं रह सकता था।
आधे घंटे आप खड़े हो गए?
बिल्कुल खड़ा हूँ।
कितनी तकलीफ हो रही है खड़ी होते वक्त? हाँ, ये बैलेंस। You could not stand for 10 minutes also, now it's standing for 30 minutes. आप हाथ को नीचे रखिए। Very good. बहुत बढ़िया। You could see more than 70% recovery of paralysis in just 20 minutes of the treatment, and patient has recovered almost. आपने 2.5 साल में और अभी में कितना डिफरेंस पाया?
मैं हकीकत जब होते ही से 2.5 साल ऐसे घुमा दिया, ये हालत में सोचा।
नहीं, उन्होंने मेहनत पहले से करके रखी थी, मुझे फल मिल गया।
वो देखो वो मैं बोल नहीं सकता सर, मैं बहुत देर कर दिया पिताजी को यहाँ आने में, इतना सोच रहा हूँ बस और कुछ
नहीं। उन्होंने सही गाइड किया, स्टेम सेल थेरेपी और ये देते ही उन्होंने मुझे फोन करके बोला था कि NIBS कर दीजिए, पेशेंट रिकवर हो जाएगा।
लास्ट टाइम मेरे को लास्ट वीक थोड़ा मैं आपकी बात एक नहीं सुना, वो भी मेरी गलती होगी।
मैंने आपको बार बार कहा था मुझे NIBS करने दीजिए।
NIBS सर उन्होंने रेड्डी साहब ने बोला मैं कर दूंगा ऑपरेशन में, तो उनको कुछ समझ में बैठा, फिर आपसे संपर्क करें, फिर मेरे को बोले ये फिजियोथेरेपी का उनको कुछ समझ में बैठा रहे। NIBS का उन्होंने बोला भी था मेरे को।
कोई बात नहीं, उन्होंने भी बहुत मेहनत की और
वो हिसाब से लास्ट वीक आप भी जरा
और अब तो पेशेंट बिल्कुल। You can do little fast forward so that you can see him climbing staircases. Make it fast forward. More than 75% of the recovery in a paralytic patient was unable to walk and was almost like a bedridden for 2.5 years. Is walking independently with 4 आदमी की support से चलते थे. Used to work with 4 people support. बेटा ये कितने आदमी, आपका नाम बताइए। हाँ, क्या लगता है आप इनके कितने आदमी के सपोर्ट से चलते थे ये? और अभी कितना आदमी का सपोर्ट ले रहे हैं? आपके हिसाब से कितना असर हो गया? 70-80%. So you could see within 20 minutes of the treatment, more than 80% recovery of paralysis patient, and I have tested the patient only for today. Thank you so much.
Thank you so much, sir.
We have cut down the videos. It's a long video of climbing staircase. These. चल के देखिए।
आगे चलो, पीछे चलो।
Finish it off. Now you may ask me a quick question. I have some emergency patient also now. You can see he can climbing. Walk. मेरी बस अब एक आंगली पकड़िए. You can see the video nicely, the Facebook. Now you may ask me a questions.
Pranam sir, Mukesh Rawat.
हाँ sir.
Sir, if there is an osteophytic growth in patella, then same treatment will work?
No, we will. There are further studies are there in osteoarthritis. We have only closed 2 chapters, right?
Okay, sir.
So
for osteophytic change,
osteophytic changes, there are different ways. I will show you tomorrow.
Okay, sir. Okay. Thank you, sir.
We are not going to run first. There is no race, right?
Okay, sir.
Are you going to run a race?
No, sir.
Do you have an exam tomorrow?
No, sir.
Then let us go slowly and nicely.
Yes, sir. Yes, sir.
आराम से जाते हैं, हमें प्रॉब्लम क्या है?
नहीं कोई प्रॉब्लम नहीं सर, प्रॉब्लम तो डेली
मेरा लैपटॉप और एक स्टूडियो आते ही I'll show you many things very nicely.
Okay, sir.
So may I ask?
Yes.
How do we distinguish between each of the different conditions? Do we need an MRI and
no. Clinically, I told you. See, clinically. What did I show you? Clinically.
Okay, so you have to do each of the clinical tests for each condition.
Yes.
Okay.
What we mistake in as a physician, TCM physician, we don't do clinical
examination.
We consider all knee pain as different knee pain, and the pain does not recover. Right?
Okay, sir.
From tomorrow, you please make some proper arrangements, especially about YouTube and all, so that they can see the videos quickly and we can show them more nicely. You are also get more nicely trained so that you can recover your people very easily, nicely, and you can become an expert. You can become as expert as pain expert of orthopedic physician.
Sir, please say again, I should make arrangement tomorrow for something nicely. You cut off the network.
Yeah, you see the slides.
Yes.
Select the topic, put on YouTube.
Okay.
see the YouTube,
Okay.
and
Okay.
also show them the X-rays.
Okay. Inshallah, the X-rays, the YouTube video for the component parts, and the
Yeah.
slides. Okay,
Yeah.
sir. And
The
pictures too.
diagnostic, that is most important, is the diagnostic part.
Okay, too. No problem, sir. Inshallah.
Inshallah, I know you will do it. Today we have completed 2 topics, and I'm sure if you arrange this nicely, I'm sure you don't need prolotherapy also, you don't need anything. Sometimes you can recover even by your finger joints. What important is your diagnosis? This is how acupressure came into being. This is how acupuncture came into being. This is how prolotherapy came into being. All what you need is to relax that extended muscle, less strain it, and the patient recovers. You see how I recovered 2.5-year paralysis patient, 64-year-old man, in just 20 minutes, who was already treated for 2.5 years. He was referred to me, my good friend. He has done a very good job in this case. Ravindra has done a very good job, and only 20 minutes job was left for me, which I finished it. That is why I say, if your work is good, you can show results to the world. Tomorrow, people will not go after all this. Tomorrow, people will go with the validity of what you have done. Am I right or wrong? This is medical science. Right? And whenever I saw the picture, please take that picture. Click the picture. And see again and again in YouTube. You will become an expert in 1 hour. Right? अब वापस देखिए उसको YouTube पर, तुरंत देखिए, अलग अलग डायग्नोसिस को पहचानिए, तो क्या होगा? आपको तुरंत रिकवरी मिलेगी. वो भी कितने मिनट में? 3 मिनट के अंदर पेशेंट बोलेगा, मैं भैया चकाचक हो गया साहब, आने वाले 40 दिन, 50 दिन, 2 महीने, 6 महीने दर्द नहीं है. If you do it perfectly. If you do nicely, within 5 months, 6 months, pain will not come. I have done. I'm doing it to the chairman of the consumer court. If I make a mistake, I have to pay a hefty fine. You can understand whom I am treating. Right?
Yes, sir. May I ask a little bit?
Yeah, please tell me.
Yeah.
The chairman is waiting for me, so I'm gladly hearing.
I
Can I
want to
leave?
know, a place where diaphragma is to be put in your new style.
That I will teach you in a different way. This time I have totally changed everything. All the styles have changed. All things have been changed. Now I will show you authentically how Siam and all best needles can be practiced and how things can be done. Thank you so much.
Thank you so much.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Take care.
Okay, sir.
Sir.
Thank you, sir.
Good night.
Thank you. Thank you.
Night,
Good night.
everyone. Night.
Thank you, sir. Good night. Good night,
Good night, everyone.
Bye.
Bye-bye.
Bye.
Good night, everyone. Thank you.
Thank you. Good
Good
night.
night.
Good night, sir. Thank you, sir. Good night.
Thank you.
Thank you, sir.
Thank you, sir.
Thank you, sir. Thank you. Good night, everyone.